Hey guys, welcome back to Honesty's channel. So this is part 2 of 35 weeks being pregnant. So we're just going to do a quick rerun of 35 weeks. The baby is about the size of a honeydew. That's 18 1/4 inches, about 5 pounds, 5 1/4 pounds. You have about 5 weeks to go in your 8th month, since we have our scheduled C-section now scheduled for October 21st. We have about 4 months to go. 4 weeks to go. We have less than a month. So most babies are now in the head down position, though our son is breech, which doesn't matter with the cesarean. And if your baby's not in the proper position, what you can do if you want a vaginal birth, ways to get comfy in bed, the baby development, the amniotic fluid's receding, physical development is pretty much done. He's just packing on weight. So symptoms that you could be having at 35 weeks are heartburn, bloating, clumsiness, and boredom. Your pregnancy checklist for 35 weeks is to know the stages of labor, install your car seat, and wash your baby's clothing and bedding. We pretty much have all of that done, and I have just a couple outfits that I still have to wash, but as soon as I do, I'm going to be, and just a few items that I need to purchase for my hospital go-away bag. I'm going to make the video of the ultimate hospital checklist, and I will put it with all my other videos on Honesty's channel, my pregnancy blog, and my channel. So you guys can check that out for mothers' hospital bags, babies' hospital bags, and your partner, whoever's going to be in the hospital with you. And so knowing the stages, labor's divided into 3 main stages, and so you might feel a little better about being prepared for labor and birth if you just study a little more about that. So that's pretty much it for a catch up on what is happening at 35 weeks. Please refer back to my 35 weeks pregnancy vlog video, part 1, and let's jump into what's been happening this last week. 34 and 35 weeks were so busy and hectic that we weren't able to film until later on during 35 weeks. So I'm like halfway through this week. Just doctor's appointments, stress tests. I've been going to the stress test, monitoring the baby's heartbeat and movements. We actually got Henry to jump like 3 times this last Friday after a half an hour of laying there and him not moving very much. My doctor's like, let me get a medical assistant. She's better at this than I am. So she came in for an additional like 10 minutes, and we monitored Henry's heartbeat, repositioned the monitors, and my stomach like jumped like 3 times within those 10 minutes. And my doctor was like, well, at first there wasn't enough movement, but now I'm like thinking there might be too much. Just joking around. So, and his heartbeat is like perfect as usual, and so usually he doesn't want to be moving around at those appointments because it's so early in the morning. And even with like snacking, eating breakfast, drinking ice water, he doesn't like to be moving. I had to scoot up because they have me in the laying position when I do that. And I requested like to elevate my head more because I know that my son moves more when I'm not laying flatter. So that was good. And, you know, it's harder for your baby to move at this point during the pregnancy because there's not much room left. So during 34 and 35 weeks, we also picked up a packet for an advanced directive, which is basically the power of attorney directive. It names someone that you trust to act as your agent if you're unable to speak for yourself. if anything happened, God forbid, during surgery, and it's not only a C-section or cesarean, any surgery that you do, basically you have to have a power of attorney or fill out an advance directive and medical power of attorney. So my husband is my power of attorney, and we are just filling all of that out in the past couple of weeks, just going over the details. He knows all of my wishes and everything. And he only has that power if I am unable to speak for myself. So we're all on the same page there. We just need a notary to sign it, or two witnesses to sign it that are not of our family. So, I mean, I might, if I don't get a notary, I might just ask someone at the hospital if they can be a witness and sign it. There's that, and it's very important. So if you already haven't done so, you can ask your hospital, health center, or doctor about getting one of those. And then, so I talked to my surgeon finally. We are having the baby scheduled for October 21st, which is going to be the day after our daughter's birthday. So she's turning 5 October 20th, and then Henry's going to be born October 21st. Surgery is to begin at 8:50 a.m. So it's all scheduled on a timeline. You want to show up at the hospital about 2 hours early. They told me I can be there at 7 in the morning. So I am going to show up at 7 a.m. on that Monday. And then they gave me a packet here. So this is for the surgery. Looks like that. It was issued just like 4 days ago. Has my name, our surgeon's name, the name of the procedure, which is a repeat cesarean section. The date's going to be Monday, October 21st, 2019, at our hospital. Time of surgery, 8:50. Check-in, at least 2 hours before, but we're going to be there at 7 instead of 6:50. So, 10-minute difference, not that big a deal. But it is good to get as early as possible, because I have to be fasting from midnight up until the surgery. I can't even drink water. And it's going to be really difficult for me not to drink any water or milk, especially with the heartburn. I wish I could sip milk or water, but I can't. And once I'm there, they won't give me any either, but they're going to give me, inject me with fluids. So I won't be dehydrated. I'll be getting hydrated through the fluids. But it's not the same as being able to drink something. So I'm just complaining. At least I got an early time. And I didn't get the date that I wanted, the 24th. But, so now just for the rest of our lives, we're going to have our daughter's birthday. And literally the next day is going to be our son's birthday. So I'm just going over this in my mind. And my husband's going over in his mind, birthday parties, birthday presents, having a boy and a girl wanting 2 different themes, and you can't really combine it. And you don't want them to feel like they're left out, so they each have to have their own thing. But it's okay. October is going to be a crazy month, just forever. It's our kids' birthdays, and then Halloween. And then we have Thanksgiving and Christmas. That we're just going through it in our heads, but we'll get through it. So, and maybe it will be fun having them so close together. I don't know. Our October babies. So, And it talks about preoperative preparations. I'm going to have a pre-op appointment scheduled for Wednesday, October 16th. At 11 a.m. I have to meet with my surgeon for a pre-op. And then I may be scheduled an appointment with my primary care provider, doctor, prior to the surgery date to medically clear me for surgery, but I don't know. I doubt that because I'm already medically cleared for surgery. We've been planning this from the get-go. Says the hospital pre-op nurse will give me a call a week prior to surgery for the pre-op labs and an EKG chest x-ray if needed. So I also have to make sure that I fill out the pre-admission health history questionnaire forms and bring them to my pre-op appointment. Now, a post-operative appointment will be scheduled by the health center's personnel while I'm in the hospital. So this is the form I have to fill out. I have some time to fill it out. A couple weeks, right? So it's like, take a look at the calendar. It's the 24th now, and the appointment's on the 16th. So yeah, I have like 3 weeks to do this. I mean, I could do it right now. And just keep all of this paperwork together. So basically, it's like patient's name, date of birth, surgery date. And then you just answer the questions. Please answer the following questions by checking Y for yes and N for no in the appropriate boxes. If answering yes, please comment. Use the comment section to provide more information. Now, this is just for your surgeon. Since I am having a repeat C-section with the same surgeon that gave birth, helped me deliver our daughter Ariana when I gave birth to her. She pretty much knows my medical history, and she has me on record she can read my medical record. But in case I do go into labor early, there are 2 other surgeons that are able to do an emergency C-section with my clinic and health center. So, and all the staff in the health center goes to the local hospital right down the street to where we're going to give birth. But this is just good for them to have, even if they can reference your medical records. So, like, it basically asks you, do you have any histories of strokes, TIAs, seizure disorders, neuropathy, motion sickness, paralysis, chest pain, apnea, heart attacks, MIs, coronary artery disease, heart murmurs, heart failures, cardiomyopathy, pacemakers, defibrillators, irregular fast heartbeat, or heart valve disease. Blood pressure, high or low, peripheral vascular disease, asthma, chronic cough, pneumonia, chronic bronchitis, COPD, emphysema, recent cold or pneumonia, snoring or sleep apnea. Can you walk a flight of stairs or hill, or do heavy housework without any chest pain or shortness of breath? Hiatal hernia, gastric reflux, GERD, gastric ulcers, hepatitis, liver disease, GI bleed, kidney disease, dialysis, kidney transplant, prostate issues, urinary tract infections, incontinence, arthritis, unexplained bleeding, blood disorders, or blood clots. I pretty much don't have any of that. Now, yeah. I was thinking maybe gastric reflux, but no, that's not like, I have this reflex with like the heartburn and everything from being pregnant. But other than that, no. So, none of those. Or do you have or had a history of like back spine problems, cane walking or wheelchairs, artificial joints or body parts, limitations, mobility, wounds, open sores, rashes, diabetes 1 or 2, insulin-dependent oral medications, diet control, thyroid disease, anemia, cancer, HIV, AIDS? Now, I have been anemic during both of my pregnancies. More so with our daughter, I had to take iron pills. And I'm a little anemic now during this pregnancy, but not so much that I have to take iron pills. I'm just trying to eat more protein. I was a full-fledged vegetarian most of my life until I was pregnant with our daughter, and then I started eating chicken, and I never stopped. So I currently eat chicken, but I don't eat any other white meat. Sometimes fish, very rare. And I don't eat any red meat at all. So my doctor's aware of that, and so I'll probably just check anemia and write a little comment about that. So the other symptoms are MRSA, or if you've had any history of this stuff, CGIF, I don't know what any of this is, tuberculosis, vision or hearing problems, caps, crowns, dentures. I have had caps and crowns prior when I was really young, but yeah, I don't think that's going to cause any problem with the surgery. Psychiatric disorder, anxiety, depression, dementia, Alzheimer's. Have you had any thoughts of harming yourself or others? Previous suicide thoughts, attempts, Parkinson's disease, chronic pain, fibromyalgia, pain score, blank to 10, worst. Are you or could you be pregnant? Well, yes. Yes, doctor, I am pregnant. Nursing, LMP, postmenopausal age, hysterectomy age, smoker, recreational drug user, alcohol type. So this is pretty much a pre-admission health history database for any surgery. So not just for cesareans. So don't let it scare you. Same with the advanced directive, power of attorney, whatever surgery you're going to have, you just have to fill out these forms. Better be safe than sorry. So don't let it scare you. And then on the back, height, weight, BMI. Do you have any history of anesthesia complications, severe nausea, vomiting, difficult intubation, family history of anesthesia problems, unexplained high fever during or after surgery, blah, blah. Now, for cesareans, you're not going to be under anesthesia. You are fully awake, but with a spinal tap or a shot in your back, you're not going to feel any pain from your chest down, but you will be awake, so you don't have to worry about that. Like an epidural or spinal tap. Spinal tap's pretty much the same thing, but it's just a longer needle and a little slightly different part of your spine, and it's stronger than an epidural slightly. So that's what I'm going to be having. Have you seen a cardiologist in the past year? So they just want to check up and make sure they know all of these questions. If you have a caregiver, who will be your caregiver after surgery? And then home environment. If you have any allergies, please list the medications, prior surgeries that you may have had, when did they occur, and is there any other health information that we should be made aware of? So it's pretty much that simple to fill it out. I got that. I'm going to fill that out, bring it to my appointment here coming up in 3 weeks. Got a map of the hospital if you don't remember from your hospital tour where to go. But you can always ask your surgeon too, like what door you're supposed to meet at in the morning or whenever your appointment is scheduled. I got an outpatient laboratory service. It says moving to better serve you paper. It says please get your blood drawn 2 to 3 days before surgery date. The last draw is done. The 1 hour closing time, and it gives me the address and the times of operation that they are open. So I'm going to talk to my surgeon about this piece of paper. I guess I have to get my blood drawn 2 to 3 days before surgery date. Now, I haven't had a C-section in about 5 years now. So it's kind of hard to remember everything I had to do prior, like right before the appointment. But then we have these papers that also came with my handy dandy packet for my surgery. It says 1 week before surgery. Your pre-surgery interview will be conducted over the phone. Pre-admit nurse representing your hospital will contact you to review your health history, medication list, and any other pertinent information. Pre-surgery nurse will reference your completed pre-admission health history questionnaire as provided by you and or your surgeon. And if you miss your pre-op call from the nurse or would like to speak with the nurse, you may call at any time and provide the number. After you've read the information in this packet, please feel free to write down any questions that you may have for a nurse. So it is important to know, please ensure all of the lab work, x-rays, EKGs, and clearances are completed. Failure to do so could result in the postponement of your surgery or procedure. And then the day of surgery paper. Do not eat or drink anything, including water, after midnight unless otherwise instructed. So you have to fast from midnight until the surgery. Please arrive at the day surgery unit, the DSU, 1.5 hours prior to your scheduled surgery time. Like 2 hours. More like it, unless otherwise instructed. DSU is located in the back of the hospital adjacent to the emergency department. And then there was also a map included with the list. Please bring a copy of your durable power of attorney, your advance directive, for the health care if you have one. Also, it doesn't say hurt, but it would also be good to bring a copy or multiple copies of your birth plan. I have a video talking about birth plans in my channel, in my vlog. So if you did make a birth plan, just pretty much the same thing as what your power of attorney would know, but it might go a little more into detail. And then you can have a couple copies, give it to the nurses, give it to the doctors, family members, have a copy on you. It's good to have, and have multiple copies. So make sure you bring all of your insurance cards, ID, but leave all of your jewelry and valuables, wallets and purses at home, unless you give your wallet or purse to your partner. Now, I'm going to have to take off my wedding ring, but, I'm keeping it on for now. But, yeah, it is, like, some days it's tighter. I just had to, like, wiggle it to loosen it. Today it's tighter. But, like, some days it's really loose, too. So, it's just the swelling of my hand. It goes back and forth. But they don't want to have to cut it off. Or, because they will do whatever it takes to get that ring off you before surgery. So if they are going to do the dental floss trick or just have to cut it off, it's wise to just take off your ring, and then you can always put it back on after surgery. So and any other jewelry that you may have. Ensure all of your studs, rings, and other jewelry from body piercings have been removed prior to surgery and left at home. So like earrings, eyebrow rings, belly button rings, navel, tongue, anything, nipples. If you will be going home after your surgery procedure, please finalize arrangements with your significant other, family members, or a friend to drive you home. This is especially important if you will be receiving sedation or anesthesia. Outpatient parking is located on the map. So I will be staying in the hospital for a few days, but after a cesarean C-section, I am not allowed to drive. I'm unable to drive. But my husband will be staying there in the hospital with me the whole time. So he is going to be driving me and our son out of the hospital when we are finally released. And then we're going to pick up our daughter from Grandma's house and go home and bring Henry home for the very first time. Yay! To our new house and his new nursery. And welcome him into our home and our family. So he's already been a member of our family for going on almost 9 months now. But
Mommy,
so
say hi.
no.
Say hi.
And then we have a paper here talking about recovery and care after a C-section. So we can go more into that in our next video when we talk about recovery and care after a C-section. And then I'm going to be making some videos about the hospital bags coming up too. So thanks again. If you didn't catch part 1 of this video, find 35 weeks pregnancy vlog part 1. And we are wrapping up pregnancy vlog at 35 weeks part 2. And I will talk to you guys when I am 36 weeks, unless I go into labor early and I have to make an emergency video. So I will see you guys soon. Thanks for tuning in to Honesty's channel. Have a great day.